today we're going to do a HydraFacial on Amanda, and just looking at her skin, we're probably going to do the clarifying facial. She doesn't have a lot of issues, but she's got a little bit of brown hair, a little enlarged pores in the T-zone area, and you know, she's over 30, so she wants to start building some collagen, because by the time you're 30, your collagen level really slows down reproducing. So what I'm going to do is a clarifying facial, and first I'm just going to start with a pre-cleanse before I start with the HydraFacial system. So this product is an AHA, BHA, they call it Aha Baha cleanser, and it is made by Skin Medica, and I'm just going to do a cleanse. It has a little kind of grainy in it. You can use this, some people can use it every day. Some people I tend to have them use it 2 or 3 times a week. I like using it in the shower and leaving it on the whole time I'm in the shower, because even if you're not scrubbing it with the AHA and the BHA in it, it is still working. So AHA works from the outside in, and the BHA penetrates into your skin and works from the inside, pushing out the debris out of your skin. So a HydraFacial, you can essentially do it a day before you have an event. It really, your skin is just glowing and nice, and generally will stay that way for about 3 weeks. So a recommendation on HydraFacial is about once a month. So the first part of this HydraFacial is it's just cleansing. So while it's going onto her skin, it's also being sucked. It's like a little tornado, and it goes onto the skin, and then it sucks up the debris back into the little waste receptacle. This product has a lot of glucosamine in it, so it does soften the surface layer, but it also, glucosamine comes from shellfish, so if you happen to be allergic to shellfish, you could not do this facial. This whole treatment would normally, signature HydraFacial, take about 45 minutes, but I do add a collagen mask at the end, so that extends the time of it a bit. Amanda has microbladed brows, so I will stay away from her brow area when I get to the AHA or glycolic part of the facial, because that will fade them. Going to step 2, which I'm just taking that little part out, and I'm going to add an AHA glycolic of 7%. So this is just going to be a light peel. Most people don't even see that they're peeling at home afterwards. It just is going to lift some of the dead skin off. And I do a little massage afterwards just to leave it on a little bit longer. But again, like I said, most people don't see that they're going to be peeling 2 or 3 days later. Their skin just looks really amazing. The third step in this is extracting with the machine. I like to do just a little massage with this AHA first before I do that. And honestly, I just do the areas where they have congestion, so usually it's T-zone area. And then I also do manual extractions afterwards, because there's some things that the machine is not just going to lift out, and I can do that myself. Now, if Amanda had like acne prone skin, then I would probably do the extraction over her whole face. If she tended to get blackheads or just clogged pores, but she doesn't, so there's no reason to do her entire face. And then we're going to remove the AHA part, and then we're going to go to, her skin's all prepared now to accept a lot of hydration. So we're going to start using a serum on her skin and just get, put as much moisture back into her skin as we can. And again, what I'm doing here is 80% of your treatments. I mean, 20% of your treatments. 80% of what you should be doing is at home. So you will be using some of these products, like if she's really kind of dehydrated, especially this time of year in the winter, she could be using an alpha hydroxy product that's going to help her retain more moisture. And then at night she's going to be using a retinol product, because retinol helps to produce collagen. The three retinols we have, the 0.25, the 0.5, and the 1%. If you're just looking for anti-aging, you probably are just going to stay at the 0.25. If you have acne-prone skin, you're probably going to eventually go to a little bit higher level. All three of them are going to give you the same production of collagen. The higher levels are just going to give you more exfoliation. So now we're just going to start putting a lot of moisture back into Amanda's skin. This is a serum, so it's going to tone, tighten her skin. It'll make her skin look really glowing. And then I'm going to use LED lights over this. That helps with any irritation and also helps to just push the product deeper into her skin. Because I'm going to do the LED lights, and like I said, these help to just push the product deeper into your skin, and it also helps with people that get irritation from some of the products. So some of the other products that Amanda could be using would be the TNS if she is worried about the lack of collagen in her skin and help with line refinement. That's a product that you can use day or night. Actually, you should eventually use it day and night, and it actually helps to, it's a growth product, so it helps to produce collagen. Also, one of our newest products is that LumaVive, and the LumaVive is a daytime and a nighttime moisturizer, and it actually helps with blue light. They've been doing studies about blue light and all of the electronics that we use, and the studies that have even shown, like, young people in their 20s and 30s, that they're actually losing more collagen quicker than people of my age, like 60, because we haven't grown up using the electronics. So that's a daytime and a nighttime moisturizer, which works very well to hydrate your skin, but it also protects you from that blue rays. Kind of helps, you can feel the products kind of penetrating into your skin and your skin feeling tighter. So for most of my patients here, I tend to go back and forth with either a microderm or a HydraFacial, or maybe even throw in a chemical peel. I don't tend to every month do the same thing because, you know, obviously here in Kansas the weather can be very different, so you can be oily in the summertime and you can be dehydrated in the winter time, and so I definitely switch it up and individualize any treatment. Now for the signature HydraFacial, that would pretty much be the extent of the whole facial, but I personally always like to do either a collagen mask afterwards, just do a little more massage on the skin. Today I'm going to use these little brightening, instant brightening eye mask. These you can use them for a 15-20 minute period. I have a lot of patients that just use them at night and just leave them on overnight, and they will tone and tighten and brighten that eye area. It does have pretty much the same ingredients as the Lytera 2.0, but it's more specifically for the eye area. And Lytera is a pigment reducer. So it doesn't have hydroquinone in it, which you can't stay on hydroquinone all the time because it metabolizes through your liver. But this does not have hydroquinone in it, and it works very well for the browns. So I'm just going to use a little tiny drop of that right here. And then we're going to leave this on for about 15 minutes. And that is the HydraFacial. And Amanda is sleeping.